Community investment, otherwise known as place-based investment, helps create the social and physical environments that support community health over the long term. Hospitals and health systems are using this anchor mission strategy to address housing insecurity and other social determinants of health and ultimately advance health equity. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. To learn more about how community investment can align with a healthcare organization's broader commitment to improving community health and health equity, Nancy Myers, AHA's Vice President of Leadership and System Innovation, speaks with Kendra Smith, Vice President of Community Health at Bon Secours Mercy Health, and Cheryl Garland, Chief of Health Impact at VCU Health System. This podcast is part of AHA's series, Community Investment, Conversations with Senior Leaders.
Thanks, Tom. And Kendra and Cheryl, thank you for joining us today. We really appreciate your time and your expertise. VCU Health and Bon Secours Mercy Health have both made significant commitments to the economic health of their communities to address health disparities and ultimately improve community health and advance health equity, at times even collaboratively and together. So to start off, I'd like to briefly talk about each of your systems' approach to your anchor mission and place-based investing or community investing strategies. So Kendra, I'm going to start with you. Bon Secours Mercy Health has a rich history of affordable housing development and impact investing. Could you talk about how that history has influenced your system's current strategy and goals?
I think to be in a system that has such a long history, so if you look at the work that we started in Baltimore more than 30 years ago in modern time today, owning and operating more than 800 units of affordable housing and the investments that we've made in Cincinnati and Richmond and a handful of our other markets, I think originally it started as you're stepping in where others would not and really trying to fill a gap in the community. But for us, as we've grown as a system, as we have grown in our knowledge of this work, part of our strategy is really about who do we partner with to bring along with us if they're new to the space, but also who is already in this space that we can come behind and support. And so I think as we continue to develop our strategic plan, as we continue to develop our goals, partnership in investing is really a big part of what we do, but also making sure as a system that we're making both the financial and human capacity and human capital commitment to make sure that our communities are well served by Bon Secours Mercy Health and that we're supporting projects that not just improve quality of life for our patients, but also the communities that we serve. And so that longitudinal view, the stumbling blocks, the successes, the challenges, all of that is really going into creating our present day strategic plan and how we want to move forward in the space.
Cheryl, I want to turn to you as well. VCU Health is a critical anchor for your community, both as a health system and as an academic medical center. Can you tell us about VCU's role and approach, especially in the Richmond area?
So thank you, Nancy. It's a great question. And as you mentioned, VCU plays multiple roles from an anchor perspective. One, from an academic standpoint, we have the opportunity to really think about what role does our university play in supporting the education, not only of our students, but to bring outreach and engagement support to community-based organizations that are trying to fill critical needs in the community at large. As a health system, we take our anchor institution role very seriously as well, and that we see that not only are we one of the largest employers in the region, but that we are also an investor. We're also a purchaser of services. And so we look for opportunities on a continuous basis to figure out how to support the overall economy of not only Central Virginia, but in the other regions of the state where we have a footprint as well with our facilities. And so we have taken a very holistic view that we're not only here to provide great education to the future workforce not only in the Commonwealth of Virginia, but many of our graduates go on to other parts of the country, but also from a healthcare perspective, that we contribute much more than great quality and safe care for individuals who come here, but we're also giving back to the economy. We are very intentional in our hiring practices in reaching out to partners to figure out, especially our local schools and local community colleges, how can we bring people into our workforce? And then what is it that we are doing to invest into the local economy?
Thanks. So I want to pick up on that and maybe ask a different question, starting with you, Cheryl, and then ask Kendra to weigh in as well. A critical component for success is that community investment needs to really be aligned with health systems, and in your case, Cheryl, an academic system's overall strategic plan. So it can't just be a project on the side forever. At some point, it needs to just become part of the way that we do business and part of that overall strategic mission. So how has that evolved within your organization? How do you see the role of community investment becoming part of the mainstream ongoing strategic mission for VCU?
So the role of community investment really is embedded in our strategic plan for the future. What we see is important, again, is not only the need to ensure that we are focused on providing safe, quality care for all who seek services within our health system, but we also think it's important that we understand very clearly what our role is as a community partner, that we take very seriously the workforce that supports us. It's our number one asset, is the people that work here who give back to our community. And we think it's very important to think about not only the current workforce, but the workforce of the future. And so we've made great strides in looking at how we develop programs to introduce health careers to young people in the local school systems and to other universities and colleges in the region. Last year, we had over 1,000 young people who were engaged in programs across both our medical and academic campuses to help them to think about what do they want to do when they grow up. About 15 years ago, we started a program called Jump Rope to Stethoscope, where we reach out to children as young as kindergarten to help them to understand that there are multiple careers that you could think about in a healthcare setting, because a healthcare setting is like a city. You can be almost anything you want to, and we need your help. And so we really want our children in our communities to start thinking about how can they stay here and give back. About 2 years ago, we started a workforce development program. We actually partnered with Bon Secours around this, where we reached out to the local public schools and focused on providing opportunities for individuals between 18 and 26 who were primarily living in low wealth communities to learn about entry-level positions in our organizations, go through a mini intro to healthcare that they may not otherwise get an opportunity to have, and then connect our managers with them to do mock interviews, let them shadow individuals, with the goal of, at the end of our sessions, that we help them to fill out job applications and actually move into entry-level positions. And then when they get into our organizations, provide them with career development support so they can map out their career paths to whatever it is that they might want to be.
That's fabulous. Kendra, I want to ask you a similar question. You had talked a few moments ago in terms of the Bon Secours Mercy journey around your housing development and its evolution, that you started to take very much a longitudinal view of that work. How are you also thinking about integrating that work, not just as its own swim lane that's longitudinal in nature, but bringing it into the overall strategic plan for Bon Secours Mercy Health as a system.
Yeah, I think very similar to Cheryl, Cheryl's comments around VCU, I think we've really taken this holistic approach and said it's not only about the dollars and resource that we're able to invest in the infrastructure of a community. We're really kind of committed to also looking at our vendor strategies and what does our supply chain look like. And so we've really committed ourselves to diversifying our vendor base to make sure that we're hiring local vendors and creating opportunity for local businesses to build capacity to be part of our supply chain conversation. Similarly, we're also looking at our workforce strategy and making sure that the zip codes around our facilities are well represented, that folks that are interested and able and willing to come work with us have the opportunity to do that. And whether that is through training, at Mercy College, which is our partner education institute, or whether that's another institution and they're funneling in. So I think for us, that housing investment piece has really just broadened to encompass to say, we can't just think about one piece of this at a time, right? So the more that we can impact community as place, right, the stronger our community is. Strong communities produce strong individuals. We want those strong individuals to come work with us. We want to create and drive business development. We also want to provide great care to our patients. And if we've really kind of connected and engaged the community in the right way, that some of those folks begin to overlap. And so you've really created this community atmosphere, sometimes centered around a Bon Secours facility, but oftentimes not. Oftentimes where there is a supporter or a resource, we don't always have to be out front. But I think working in that housing space really helped us understand how to gauge the community need, how to interact with people, how to ask people what they want in a way that allows us to be realistic about the outcome. What resources are needed? Who else is doing this work and how do we support? So I think it was really just the starting block for us. And you see that now as we continue to evolve as a system, that community aspect, that engagement aspect is front and center of everything that we do.
So to pick up on that, that kind of is a nice segue to the next thing I wanted to talk to you both about, which is community engagement. And how do we really become deeper in our relationship to community so that the folks that we're seeking to serve are at the table co-designing initiatives with us, not just giving input after the fact. Can you talk a little bit, Kendra, about how you've integrated community voice? You talked about that community engagement becoming more and more central. What are your tips? How have you done that? What kind of advice could you give to other systems about how to do that work and engage communities differently?
So I think it's twofold. So I think one, recognizing that community engagement is not going out into the community, whether that's every 3 years around your CHNA cycle, whether that is you need input for this one project this one time. That is not authentic community engagement. And I could talk about this all day. I started my career as a community organizer, and I think the number one thing that I learned was that listening is key. The same strategic conversations that you're having around the table at your health system, your health facility, the community more often than not has been having for a very long time. They may just have not found the right partner. They may not have found the right path, but very rarely are those conversations new. And so I think, when you want to authentically engage community, you have to show up knowing that you've done your homework, that you've researched, initiatives that are already happening. You're not walking in as this savior agency that is going to solve all the problems, because more often than not, the community is ready for someone to listen. They've actually done a lot of the hard work. And so you think about, where are you showing up to volunteer? What boards are you sitting on? What causes are you supporting? What community-based organizations, are you speaking with on a daily basis? What residents are you, connecting with, and where are you doing those spaces? And I think being able to meet people where they are without an agenda, sometimes it's just attending an event. We may not have a Bon Secours Mercy table. We may not be there to share information. We may not officially be a sponsor, but sometimes it's just showing up. So I think it's, how you authentically enter a space, but I think also preparing to know that this can take a long time. And I'm sure Cheryl can speak to the same thing. We have residents that tell us 10 years later that they finally understand what it was that Bon Secours Mercy was trying to do when we first entered the neighborhood. Whether it's a housing project and they thought we were just trying to buy up all the houses to tear them down, to now 10 years later, they're like, we finally get it. You've shown us, that you're in it for the long haul. So I think those two things, entering a space authentically, thinking that you know the same or less than folks that have been in that community for a long time, and knowing that it does take time. This is not a one-off process. And so not rushing that process too goes a long way to building trust and buy-in for real community engagement.
Great. And Cheryl, from your perspective, how has VCU Health been successful in engaging with your communities? What's worked for you?
So I think that Kendra has really hit the nail on the head around the key issues, because I agree, authentic community engagement is critical. It's not just showing up and saying that you were in the room. It's actually sitting at tables with individuals and actively listening, and then asking for feedback or opinions or advice, and being true to wanting to hear it and making sure that the information that has been gathered is important enough to influence the decisions. One of the critical lessons that I think our institution has learned is that it is a mistake to walk in to a community setting or a room with a community partner to tell them what you think they need. It is critical to come in and with an open mind and talk about what the common issue is, because otherwise you just shouldn't show up. We learned some very important lessons when our health system partnered with our university about 5 years ago to launch our health equity initiative. And it was very interesting because we started with this concept that we wanted to make sure that the principles of health equity were integrated into the core missions of our university and our health system. Seemed like a pretty simple task. And we created 4 pillars at that time around our education and training, our research, and then patient services. And the 4th was community engagement. And the very real and honest conversation that was had with our community partners who were part of the steering committee is that it just didn't make sense to make community engagement a standalone pillar. It isn't a thing you do, as Kendra mentioned. It's part of how you perform, how you act, how you engage. And so one of the early conversations that we had with the steering group that came together was the importance of integrating community engagement through every single conversation and every single activity that we moved forward with. And it was the best discussion that we had because it helped us to set the table to basically say, we're all here trying to address issues that we agree are important for this community. And now, how do we do this as equal partners?
And if I may add, I think the other thing that we learned, is that it's not just your forward-facing teams that are engaging community, right? As we think about, the training opportunities, sometimes it's your finance team, and sometimes it's your provider team, and in our case, it's always our community health team. But what does that mean for the foundation, and all of these other partners internally that are intersecting with community in any different ways? So when Cheryl talks about integrating and weaving it seamlessly through, because you never know what team is going to show up in community on what day. And we all need to show up representing our organization the best we can, but also being able to listen. You want the community to say, Cheryl's team showed up A+, and the finance team showed up A+. Everyone is showing up in the same manner. And so really being able to do that across business lines and across team within the organization is also key.
You've both referenced in your comments and as we've been talking, the longevity of this work, that this is not work that happens overnight, and that sometimes it can take 10 years for our community members to really begin to understand the investment and the activities and our intent in doing so. So, given that long term horizon of this work, of really turning a community around or helping to make large scale investments, how do we know that we're making progress? What are your systems thinking about in terms of measuring or understanding that you're on the right pathway and that you're moving in the right direction on that pathway? How do you figure that out? So, Kendra, we'll start with you.
Sure. It's definitely a multi-tiered approach. I think for us at Bon Secours Mercy Health, really the first measurement was that we were able to make a commitment of a pot of funds that in the long term will always go towards community investment. So for our treasury team, our finance team, it's really about being able to say, we've committed a percentage of our dollars to do this work. And so as we track what that means and how many dollars are available, I think that's, when we think about finance in the traditional sense, right? What is that investment doing? How are we leveraging and kind of creating this pool of funds that'll allow us to go out into community? I think from the community aspect, in terms of actually getting dollars out, it's twofold. I think for many community-based organizations, loans are a new conversation. We have a lot of conversations around grants, and that will always be a part of the conversation. But sometimes you are hard pressed to find community organizations that are at the spot where a loan is not a very scary thing for them. So we gauge community capacity building. And if we have to make a grant investment in an organization before they're ready to take the loan, kind of how are we building capacity of our local organizations? I think the other thing that we're looking at, whether it's housing and being able to count units, whether it's food and being able to count numbers served, we still want to have those really strong qualitative and quantitative measurements that folks are probably most familiar with in the grant work. And we've really kind of partnered with our foundation teams and our local community organizations to do that. I think the next step for us, where we still have some work to do, but is so exciting, to your point, long term, how do we measure the social benefit of what we're doing and the social impact, and then couple that with a financial return? And I think those two things happen to run parallel, but then they kind of veer off into two different directions. And our challenge now is, how do we continue to get those things to run parallel and eventually cross? So that is one of our goals as we think about, what is the right measurement to tell if this is working. So right now it's, great measurements that are coming in these silos. And I think the real opportunity is to figure out, how did those things start to integrate? And so we're not there yet. We had kind of our first venture into this in Baltimore in a paper that we published in partnership with Johns Hopkins that really looked at the social return on investment of some of our housing work. But I think there's an opportunity to really fine tune that method and expand it. And it's something that we're looking forward to working with other systems and other investment partners in the community to really figure out in the future.
Cheryl, how about at VCU Health? How are you thinking about outcomes and measurement and understanding you're on the right path and at the right point?
This is a new and challenging area because as a health system, it's very easy to look at dashboards and you can see how many admissions you're having or whether or not a performance improvement program changed a quality metric or a quality indicator. But this, as Kendra mentioned, that this is new and we have to think about it in a new way. And that's difficult for healthcare institutions to think outside of the traditional quantitative and qualitative boxes, to think about or to identify ways to appropriately determine whether or not the investments that you've made are making a difference. We've tried a couple of pilots where we've looked at a true return on investment, where we've worked with community partners to try and enhance their capacity to provide services to individuals who are in need, and then came back and took a look at, did it make a difference in regards to utilization for the individuals that were served, even cost? In some cases, we have been able to demonstrate wholeheartedly that the initiatives that we've supported have made a significant difference, which is great. helps those initiatives to continue and to be sustained. Where we haven't had as much traction is identifying opportunities for long-term sustainability of those models, trying to figure out how we utilize some of the new payment reform models to sustain those partnerships, to demonstrate that by investing or co-investing with partners in some of these initiatives that bring together our health system with community-based organizations and public entities to really address social issues, that we are able to say to entities that are underwriting the cost of care or social programs that this is the way to go in the future, because it really does make a sustainable impact on what we're all trying to achieve. So again, it's a new area. I think it's exciting because it will give us a lot of opportunity in the future to really test out different models and really build upon partnerships where, as Kendra mentioned, there may have been grants provided in the past, or we've tried to find some way to make an investment. But long term, we really need to be thinking about how we measure the overall impact to the populations that we're serving, not just from a healthcare utilization perspective, but from their overall health and well-being, which then gets you into, are we making a difference when it comes to really implementing the goals around health equity?
And as we sit here today and have this conversation together, it's really impossible to talk about where we are and where we're going in healthcare without recognizing the ongoing impacts every day of both the pandemic and the social justice movement in the United States. I mean, certainly both have brought light to the inequities that we have, and have exacerbated those inequities in ways that we could not have anticipated a couple of years ago. I know both of your organizations have joined in to the Healthcare Anchor Network statement committing to address racism and public health disparities that are caused by racism. I'm wondering, has that commitment and has the moment that we are in today resulted in any shifts in your strategy or approach, or has it just affirmed the direction that you've been taking? So Cheryl, I'll start with you.
This has been a very difficult year and a half for all the reasons that you have expressed or you've noted. It's been a time in which there's been a lot of reflection that's gone on within our organization at all levels, and has helped us to really affirm why it is that we're here, our commitment to providing care and services and support to all populations. And as you've mentioned, activities, the social justice movement, and then coupling that with how we support individuals during a pandemic has created multiple challenges. But I'm so excited that I've seen my team members and colleagues really rise to the occasion. We have been very, very introspective in thinking about all the data that we've collected and all the quality discussions that we have, and whether or not there's a need to step back and begin looking at all of our metrics in our dashboards using a health equity lens. To ask the questions when we see data that looks okay, is it okay for everyone? Or is there a deeper dive that really needs to occur? Because we understand that as the largest safety net healthcare provider in the Commonwealth of Virginia, that we serve populations that are dealing with multiple challenges every single day. And while our patients may come in with a clinical condition, when they leave, many are still facing social conditions that are drivers and that impact the health outcomes that we look at on our dashboards. So it has required that we step back and really think about, what role do we play? How do we lean in just a little bit more and be more intentional in taking a look at our data and developing our programs and thinking about how we interface with our patients. We know that many of our patients come to us and they are faced with many health related social needs that are driven by the social determinants of health in the communities in which they live. It has required us to then step back and say, while they look great walking out the door, is there something else that we can do as an institution to address some of those health related social needs? Can we enhance what we're doing around things like transportation and access to food and ensuring that people have access to safe and stable housing on an ongoing basis? And that may really have an impact on whether or not they get readmitted in 30 days or end up in the emergency room again. So, long winded answer just to say it has made us think differently this past year and a half because we know, and the data is very clear that COVID-19 has disproportionately impacted Black and Brown communities. And if nothing else, has just highlighted disparities that have existed for a very long time. And here's an opportunity for health systems across the country to really think about the role that they play, not just during this pandemic, but going forward and thinking about what are the additional things that we should do in order to close those healthcare gaps.
Thank you for that. And Kendra, how has the path been shaped for Bon Secours Mercy over the last 18 months?
Yeah, I think, the last 18 months have just been something that, nobody was really, imagining when we put this together. And I think, there's a part of our mission statement that I think speaks to the work that we've done. So there's a part of our mission statement that, says our goal is to bring good help to those in need, especially the poor, the underserved, and the dying. And so when you enter an organization that has so plainly relayed that as the mission, I think the last 18 months have really helped us and had us re-examine what that means. So whether that is from the social justice angle, whether that is an enhanced lens on health equity, the baseline was there, but it really has helped us have different conversations across the ministry. And so I think about, acknowledging one, that this is not, the social justice issues are not new, right? So walking into a lens that, again, the community has been fighting and working toward this, for this, with this for a very long time. And so, how do we use our platform, our resource, our commitment to our mission to support that work? And that is everything from looking internally, so making sure that our workforce represents the communities that we serve, making sure that we've got a plan for inward mobility, making sure that we are tapping in to the diverse resources that are in our communities. And whether that be ethnically and racially, whether that's economically, there's a lot of different ways to touch that space. And we want to make sure that we're doing that to outwardly supporting, whether that is vaccine drives in our communities and making sure that we're getting to those most in need, whether because it's an access issue, a language issue, a hesitancy issue. How are we supporting the phenomenal community coalitions that have come together in many of our markets to support that work? How are we using our pharmacy resources? How are we using our clinical providers? Our frontline staff has been phenomenal during this time, and really just saying, how do we help those in need get the resources? And so I think for us at Bon Secours Mercy Health, it's really been a reframing of a conversation that we've been having for a long time. But I think being very intentional to be very honest about what it is that we've done well historically and where we have opportunity to improve. What are the expectations that the community has of us as an anchor institution, and how do we set new expectations for ourselves as a ministry? And so I think this time has really been a motivator to say, this can't be business as usual on a lot of fronts, that we really have to align with community need, evaluate our internal practices and our internal resources, and come out of this more prepared, a better partner, a better listener, a better implementer to really have that impact. And, 10 years from now, when we're looking back and saying, remember, 2020, that we can look at that and say we did everything that we could to be a change agent, both for our patients, both for our communities as place, and even sometimes for those people that live in communities that are not our patients. What is that multi-tiered approach to say we did everything we could, the best that we could, and it really changed how we operate as an organization. And I think that's the opportunity so many of us have, not just in healthcare, but across a lot of different sectors.
So this work can feel daunting and overwhelming, and yet it's so important and it must be done. So if you were talking to someone in another health system who is starting down the pathway or maybe partway down the pathway, what do you think is one of the most important pieces of advice that you can give to others as they think about how to do this work?
I think it is important for organizations to be, number one, authentic, but also intentional in their actions. And this intentionality needs to happen at every level in the organization, from the board all the way through to your frontline staff, that it needs to become part of your culture and it needs to be driven by your mission, that this is a way to actually live your mission in an enhanced way, because we're all here as healthcare systems to provide the best care we can to the communities that we serve. But this takes us to a different level to really focus on not just the healthcare that's provided inside of our walls, but the commitment to making sure that the communities that we serve are as healthy as they can be. I also think that it gives us an opportunity to think about how to leverage our resources, all of our assets, in a different way, to really show up as not only healthcare providers, but also true members of our community and great stewards of the resources that we have been given to deliver services and to help the people that we serve.
Yeah, I would say Cheryl is spot on. That intentional commitment from the organization is going to be key. But I think the other thing to remember is that this is living, breathing work. And to be able to really move forward, for many health systems, this is new. For many community based organizations and community facing advocates, this is not new. So, who are you bringing along with you in your journey? So, right, it's after you finish figuring out what your value add, your value statement is as an organization, who do you bring along with you? Because, there's probably not a lot of health systems that have a transportation expert, that have a housing expert, that have a food expert, right? We know how to deliver care. We know how to really be that healthcare partner, but there's a lot of partnerships that go into this work. And so being also intentional about inviting people or asking to be part of a table where the conversations are already happening, because you are going to run into a roadblock where your internal team is looking at each other and saying, I really wish I would have paid more attention in that, pre-architecture, community development class, because we just don't have that expertise here. And so really being, the partner to others that you would want them to be to you, and making sure that you're not going this alone, because it really does have the ability to be fantastic and to be great if you set your table the right way. And that table is not just a C-suite executive table. That's making sure that you're integrating those grassroots experts, those folks that are living in community and working in community every day, really diversifying that partner table to have real impact.
Kendra Smith from Bon Secours Mercy Health and Cheryl Garland from VCU Health System, I can't thank you enough for your time today, and just as importantly for the thousands of coworkers that stand with you and serve with you in the communities that your systems serve. Really appreciate you, appreciate them, and thank you for building healthy communities.
Thank you, Kendra and Cheryl, for joining us and sharing your organization's story. And thank you to our audience for listening to the great advice they both shared. I encourage you to check out the other podcasts in our community investment series. You can find these and additional resources at aha.org/communityinvestment.